Hello, I'm Dr. Valas from the Family Pet Hospital, and today I'd like to help you understand laser therapy for cats. My assistant Judy is going to ask me a few questions, and I hope that will let you determine whether laser therapy is something that you'd like to consider for whatever your kitty's problem is.
All right. So, Dr. Valas, what is cat laser therapy and how is it used?
So laser therapy is literally putting light into the body. And what this light does is it's absorbed by the cells in the body. And in fact, it goes into the mitochondria, which is the little engine that runs each cell. So that the mitochondria is where energy is produced that makes the cell actually work. So the light is applied to the cat. We literally shine a light to the cat, and it's a laser light. So it's not a defocused light, it's an extremely focused light. Goes into the area that we're treating. It goes into the cells, specific cells of those areas, and it gets absorbed by them. And the little engines, the little mitochondria, produce energy and get those cells back to work. And that's how you get them back to work, which means that they're healing, which means that they're functioning again.
Okay. And how is laser therapy able to improve the health and well-being of my cat?
In many, many ways. So the first way is it's actually improving the ability of cells to heal. And it's doing that by increasing their function, by giving them more energy to function if they're old, tired, or diseased. And it also is removing the inflammation and removing the pain. So laser has another function that is to decrease inflammation, decrease cell death, essentially, because when there is inflammation, a lot of cells are dying at the site of inflammation. And so that inflammation causes more inflammation, which causes more pain, which causes more degeneration and more sick and tired cells. So that's how it will improve whatever disease that we are trying to treat in your kitty.
Okay. And why is it important to avoid self-diagnosing whether my cat is experiencing pain?
Well, in cats in particular, it's really hard to tell that they're experiencing pain. So I do think that you need to bring them in and have a full physical exam. They are very good at hiding pain. And by the time someone that is not experienced at basically seeing cats every day, by the time you notice pain, your cat has probably been in pain for a very, very long time. And because of that, the disease, whatever it is that is ailing your cat, has now progressed to sometimes the point of no return. So it's important that if your cat is just not right, that you recognize that there is something wrong and that you may not know what it is, and we may need to find out, but you need to take them to a veterinarian or to a professional that will diagnose it for you and tell you what is going on and how they can best help them.
Okay. And what symptoms or conditions in my cat may be treatable with laser therapy?
So again, we have a lot of really good uses of the laser. And I've used it again mostly for painful cats, but one of the ones, my favorite, is the cats that can't poop. They're constipated or obstipated, and that is a condition where the nerves to the colon, the large intestine, are just not working very well for whatever reason. And most of the time it is because there is some kind of spinal disease or something that is causing those nerves not to communicate well with the colon. Eventually, the muscles in the colon, they become flaccid, and what that means is that they're just loosey-goosey, and they're not actually functioning to push the poop out of the body. And so these cats can become very, 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 very sick. not only are they uncomfortable, but they really are toxic because they have a lot of poop in them. So obviously the first thing to do is handle that and get them, get all of that out of them. But then we need to work with how do we improve the function of the colon? How do we make that colon work better? And we have some medications for that, for sure. And some of them work and some of them don't. And if they don't, then we have a surgery. So laser comes in often together with veterinary orthopedic manipulation to try and increase that nerve function to the organ, as well as stimulate the muscle cells in the colon itself to contract and to move and start getting things moving. So that would be one. Allergies can be treated. We also have musculoskeletal diseases. I think arthritis in kitties is very underdiagnosed. When we take x-rays in older cats, we a lot of times see hip dysplasia, we see hip arthritis, we may even see hip spinal problems. And these cats have been essentially walking around like nothing was happening, but something was happening. And sometimes it's really subtle. They stop grooming, or they look kind of like groomed everywhere except their hips, or something like that, where you know that something is wrong, but you think, oh, they're just dirty, or I'm a bad parent because I didn't brush my cat, or something like that. Whereas it's got nothing to do with that. It's the cat has been in some chronic pain that did not go diagnosed.
Okay. And how long will it take for my cat to begin experiencing relief from their symptoms?
So with laser, I would say within a couple of weeks, 2 to 3 weeks, you should see an improvement of the symptoms. Again, what I feel with a lot of the alternative modalities that we use is that it depends on how long the pet has been suffering from this condition. So if it's been a long, long time, it's going to take longer for anything to kick in. And sometimes we have to use traditional ways to try and get the animals stabilized and get them, at least to feel more comfortable, and use the laser in addition to that to start getting some actual healing. I think that there is a very distinct difference between treating a condition and allowing healing to happen. So healing is different from treating, and our profession has become and is traditionally a treating profession. We treat diseases, but what can we do to make the body heal? And that's where laser comes in, and veterinary orthopedic manipulation as well. So you should see an improvement. And most importantly, the goal of laser therapy would be to try to get not just the cat more comfortable, but also on less medications. And that's always welcomed by every cat owner that I know. Is there anything that I could do so I don't have to put 3 or 4 medications into my cat and get myself ripped up on the process? This is common. We don't have a lot of cats that like to take medications, unfortunately. So this modality allows us to use less medication.
Okay. And is laser therapy capable of curing my cat?
Depends on the disease. So in some cases, yes, but most of the time when we use it, we're using it for treating a chronic condition. So we're using it to manage pain, reestablish good function, comfortable pet without meds. So if that is a cure, that would be yes, but most of these cats are not cured. They need to have something continued for life, whether it may be medications or whether it be something like laser or veterinary orthopedic manipulation.
Okay. And how many treatments might my cat require if laser therapy is recommended?
So That again depends on what we're treating. If it's an acute injury, we probably can get it done within 5 to 7 treatments, and in those cases a lot of times you don't have to do anymore. Once the cat is comfortable and done, it's done. In the more common cases, we're dealing with chronic issues, long-standing, cats on a lot of meds, and so in those cases we're probably looking at the maximum, which usually is about 14 treatments, to get the cat to a place where it's really comfortable on minimal meds. At that point, we establish a frequency of treatment to maintain them. And in most cases, that means monthly treatments for the geriatrics. So the older cats, which I would call anything over 13, 14 years old, they will probably need to come in every month to get either an adjustment or laser treatment or both. In cases with younger cats, different, less long-standing conditions, they might need a treatment or a reminder, as I say, every 3 to 4 months.
Okay, and then could my cat experience any side effects from laser therapy?
No. And, very like veterinary orthopedic manipulation, the main side effect is that you're getting the body into communication. You're improving the cell function at a cellular level. You're giving the cells more energy. They're producing more energy. So you're getting them back to work. So the side effects is you're getting them back to work. Now, there was a time where they thought that, you shouldn't be lasering an animal that has cancer. The weird thing about cancer is that it doesn't behave like the normal cells. So first of all, when we're using laser, we're using specific frequencies. We're actually plugging in these numbers into the machine that communicate with a specific type of cell. And that cell, and only that cell, will absorb that frequency of light and produce energy. So since we're not communicating with the cancer cells, we're not getting them any energy. So what's happening is when you treat a dog or a cat with cancer, and by the way, we do not use laser to treat cancer. So please do not take that as a way to treat cancer, because that is absolutely incorrect. But the side effect of using laser is that if there is a cancer, your animal is going to get stronger. Immune system cells are going to get stronger. They're going to produce more energy, and they're going to be better able to fight anything that is around them. So instead of, losing the battle, which eventually with cancer, unfortunately, they will lose the battle. But what you're trying to do is you're trying to increase the function and the energy of the cells in the rest of the body compared to the cells in the cancer. So essentially the benefit, the side effect is that while you're treating, say, arthritis, you're also improving the entire body, because many times I will use immune system frequencies and something called parasympathetic stimulation. The parasympathetic system is a system that takes care of all your organs in the body. So whereas the sympathetic system is the one that is the flight and fight reaction, which is always up when you're stressed or sick and whatever, in lieu of taking care of the major organs in your body. So when we do that, the side effect is we're making a stronger body, and cells are going to get happier and more able to fight whatever it is in there. So I think in general, what I see is a much happier patient, whether they have cancer or not.
Okay, and then last question, how will a veterinarian decide upon laser therapy as a treatment option for my cat?
How will a veterinarian?
Yes, how will they decide that that treatment is an option?
Well, usually experience. There are certain things that we treat all the time that we kind of get into a brick wall type of situation where you've tried this, you've tried the other, you've tried this, you've tried something else, and nothing seems to be working. And you hit that brick wall, the traditional brick wall. And it's time to look. It's time to expand your horizons and look at other options. And laser would be one of those other options. With cats, it really sometimes is because, they won't take pills. And how do you get them comfortable if they're not going to take pills? So this is a modality that can be used that can get cats really comfortable really fast. The other thing is that cats that can take pills, the pills may be contraindicated. For instance, steroids. Cats actually do very, very, very well with steroids compared to dogs, and they can they can tolerate them a lot better than that dogs can. But if you have a fat diabetic cat, you can't give that cat steroids. But if that cat is uncomfortable, what are you going to do? You're going to need to think about other options. And again, there are other pain medications that are not as well tolerated by cats. And we have, a laser, and we have veterinary orthopedic manipulation to help them. And as I said, because of the way that we use it, because of the frequencies that we use, we can also improve the diabetic state or whatever else, the allergy or whatever else the cat is suffering from, by just giving that body back its power to heal itself.
All right. And then if people have more questions regarding cat laser therapy, what should they do?
They should call the practice, 508-231-1223, and ask to have a consultation with Dr. Valas. Most of the time with cats that have chronic, issues, I like to see the medical records before I see the cat. So I'm prepared to do kind of like a full diagnostic kind of scenario of what are the options, and is laser going to be a good plan for this cat, or is it not? And do we need to add veterinary orthopedic manipulation, or is laser the only thing that we need to consider at this point? So just call, ask the question, try it, see if it's going to work for you. And certainly if we think it's not going to work, we're not going to use it. So if it's something that I've had experience with in the past that we're not going to be able to change it, then we're not going to recommend it.